Hi, everyone. Welcome to the Dutch live stream. My name is Joe Spector. I'm the founder and CEO of Dutch. We're an online 24/7 vet telehealth platform. And I'm here with Dr. Kate, our Chief Medical Officer. Dr. Kate,
Hi
do
there,
you want to
everybody.
introduce yourself?
Yeah, hi there, everybody. I'm Dr. Kate Elden, licensed veterinarian and Chief Medical Officer at Dutch.
So today we have a special promo, no trip 50. If you want to give Dutch a try, go to Dutch.com and try this code for $50 off. And for those who are joining us for the first time, the beauty of Dutch is you get to talk to a real vet like Dr. Kate. We're available night and day. In most states, our veterinarians are able to provide a prescription with free shipping. And you establish something called VCPR, which is vet client patient relationship, which is an important part of veterinary care and making sure that your pet is getting proper advice. Maybe Dr. Kate, you could shed light on this pretty important topic that most consumers and pet owners probably have never heard of VCPR, but it's a really important part of veterinary health.
Yeah, definitely. I think this is a good spot to pause because like when you said you talked to a real vet, I want to emphasize that through Dutch, their video visits, like every time a member logs on, they talk to someone like me that's oftentimes sitting in their home. Probably it has kids playing in the other room, and they're doing a video like FaceTime appointment, like you just would do with a friend or family member. And that video appointment is important because it allows you to establish what you said, VCPR, which is the relationship that allows a veterinarian to diagnose and prescribe. If the vet feels that they can do that from the video call, I mean, there are some times where a vet is going to say, oh, hey, you have to go in. But most of the time, we're able to diagnose what's going on through that video. Maybe like what I did yesterday was say, hey, send me a video and some pictures of that cough and that skin. Sometimes we might ask you to send us some more information. But then after your appointment with the veterinarian, after that video call, we can prescribe medications. We can prescribe diagnostics that we ship to you, and then medications afterwards. And it's different than sometimes people are going online and doing chats with veterinarians, or they're chatting with a veterinary professional. And if you're doing a chat without a video visit, you're not going to be able to get a prescription. You won't get that same kind of diagnosis and prescription because you're not establishing that veterinary client patient relationship, which is a technical term.
So this is our 6th week doing the Dutch Ask a Vet live stream, and we love questions from the audience. So if you are watching, please ask us a question and we will see it, and we'll be happy to answer it. And we definitely want to make this conversational. We also get lots of questions throughout the week, and we're going to be taking those with Dr. Kate. So please post your question and make sure you include the name of your pet, the age, and the breed. And we'd love to get it answered on our live stream. The beauty of Dutch is that we're seeing customers who are often getting care for the first time. And we have a really lovely story that Dr. Kate is going to share from a cat named MJ.
Yes, MJ. I just saw, yes, thank you for putting that picture up. This is MJ. So the story of MJ, and I just had this huge smile when I realized we were doing this customer story this morning because I remember this sweet kitten and the family so well. This family had adopted MJ, or not really adopted. They found this kitten at a goat dairy, if I remember correctly. And they were worried about it, so they rescued it. And on the video call, I saw this mom, and she had a bunch of kids like running around in the background, and this poor kitten was having trouble breathing, meaning like it had a really snotty nose and its eyes were kind of sealed shut. And for kittens, like for the first week, their eyes might not open, but once they're, a couple weeks old, their eyes should be open. They should be moving around in their environment. But this cat, like, eyes were so crusty, he wasn't able to open them, and his energy was dropping, and they were really worried. They were really worried about him. And both of the parents worked, and she was like, we just rescued this kitten. We can't afford to go take it in for a big veterinary visit, let alone like I can't take off of work in order to do that. So they asked for help. And I said, of course, of course, I'll help you. In a perfect world, would the kitten go in to see a veterinarian in person? Sure. But can we help this kitten through telemedicine? Absolutely. So I walked her through some just things that they can do that you might not think of with the things you already have at home, which are increasing the humidity. So if you can bring a kitten like this into the shower to help increase humidity, not like physically underwater of the shower, but into the bathroom and have a steamy kind of environment. And if you could do that a couple times a day, that humidity really helps cats with upper respiratory infections of all ages. Because what was likely going on with this kitten is that she had a viral infection that then became upper respiratory bacterial infection. She was getting a snotty nose from that. A lot of cats, over half of the cat population is actually infected with something called feline herpes virus, which is nothing like herpes in humans. It's an upper respiratory virus in cats. And for an adult cat, it might be really minor, but for a kitten that's still developing its immune system, it can hit them really hard. So we did triage and make sure that this cat like wasn't in a state of emergency. So if a cat is like wide armed and like open mouth breathing, I would have said, oh gosh, do not pass go. You need to go to the veterinary clinic emergency right now. But this cat was, just had some snotty nose. So I talked her through increasing humidity, using a warm, wet washcloth over the eyes, creating some more humidity and wiping there. Um, we talked about the possibility of ulcers that sometimes come with this upper respiratory infection. They can actually get ulcers on their eyes. And so she was going to be monitoring for that. Since she explained to me that MJ would sometimes like open both of his eyes bright and would only like squint a little bit, we held off doing an antibiotic ointment on the eye. But what we did start was doxycycline oral antibiotic, and we were able to ship that. And the clients were able to pick it up right away and start it for MJ. And MJ went from like, she was worried that this kitten that they had just, made a member of their family, the kids were getting attached to, she was worried it wasn't going to make it, to all of a sudden they had this like kitten that was bouncing off the walls again a couple of days later.
Oh, that's so sweet. And
Yeah.
um, and again, I think one of the other like benefits of Dutch, the beauty of Dutch, is that there is this frictionless relationship, and we hear what happened. And I think sometimes, I mean, in person, you're just kind of moving from one thing to another. But because it's digital, it's easy for us to hear what happened 2 days later. Is everything okay? Is everything better? And then we hear these stories, how things actually improved over time. I mean, it could be right away, it could be a week later. And it's so nice to have that continuous connection to the client and to their pet.
Yeah, and it's nice as a veterinarian too, because essentially for us, it's like we're texting back and forth with the client, and so the clients have this kind of access to their vet. They can send a quick photo or a message. I should read the message um, from MJ's parents. Yeah. Okay, so they said we could not afford to take a stray kitten to the vet. She was very, very sick and lethargic. We did not think she would make it. I signed up for Dutch and received medical advice and medicine. 2 days later, she was finally up and about, acting like a kitten. Thank you very much. Yeah.
Oh, it's so nice.
Yeah.
So we're taking questions from the audience. If you are new, I'm here with Dr. Kate. She's the Chief Medical Officer of Dutch. We are doing our weekly live stream, and this week we have a special promo for $50 off with the code NOTRIP50. And we're going to start taking some audience questions. We are in the middle of flea and tick season. So the first question is from Shannon Pinkerton. How do you prescribe heartworm without blood work? This is a very common question we get.
Yeah, we get this one a lot, and I answered it a couple times yesterday for pet parents. So if a pet has had a heartworm test, well, so the short answer is it depends on each individual pet. And your vet is going to have this conversation with you each time on the Dutch platform because every situation is different. And your vet is able to, like I do all the time, look up incidence maps to see how common heartworm is in your specific state. Plus, your vet's going to be licensed in your specific state. So a couple of things there. But for the scenarios I had yesterday, I asked the pet parent, has your pet been tested for heartworm in the last year? And one of the clients said yes. And I asked, okay, great. And I asked if they have been on heartworm preventative continuously for the last year since they were tested. And they said yes, but I'm about to run out and I can't get a vet appointment for 2 weeks. So they're deciding between like, oh gosh, do I lapse in prevention, which we don't want? Do I not give the pill this month because I can't get into my vet? Or do we continue prevention going? And absolutely, in that scenario, it's better to continue the heartworm preventative than to stop just because you haven't gotten the test yet. So that's one way that we do it. It depends on the situation. If a pet has not been on heartworm preventative, and they're starting it for the first time as an adult, we would have a conversation about, okay, does it make sense to start the preventative now and you can get tested within the next couple of months? Or if your pet's having any kind of signs of heartworm disease, I would say, oh no, you've got to go in and get a test right now. So
what's a sign of heartworm disease?
What are signs of heartworm?
Yeah.
Yes. So coughing, any respiratory issues, coughing, lethargy, or breathing rapidly while resting. So one thing that people don't actually realize is that a sign of heart disease is actually resting respiratory rate. And pet parents can check this at home. And this goes for heartworm, but it also goes for any type of heart disease, like mitral valve disease or other common heart diseases in dogs. A dog's resting respiratory rate should be less than 30 breaths per minute. And you can check that, probably even lower, in the mid to low 20s. And so while your pet is resting or sleeping, as long as they're not one of those dogs that's like, my dog would always like be chasing squirrels in his dreams. And you could see he was having a nice dream and breathing heavily. As long as they're not dreaming and they're calmly resting, you can just count how many breaths they have. I count for 30 seconds and then double it. And so if their resting respiratory rate is like 30 or higher, that would be a sign that, okay, maybe we need to have them checked out by a veterinarian. And those things are uncommon, but worth noting.
On that same kind of note, and we get lots of questions around like this one from Kimberly and Mosley, can you prescribe Bravecto? But we probably get questions around any of the medications, Bravecto, Credelio, Simparica Trio, NexGard. It's interesting. Why do you think parents think that are there vets who only prescribe a certain brand but not other brands?
I don't know. I ask myself this question in veterinary hospitals. Oftentimes, just because it's hard to keep stock on a shelf, oftentimes a veterinary clinic will only keep like one or two. I've worked in vet clinics where you have to make a decision because you only have so much room for inventory. Like we're going to carry Credelio and Credelio Quattro, and then they won't have the other brands. So maybe that's where that question is coming from. I mean, we don't have that same issue because it's the physical space is not the issue for us.
Mhm.
So yes, we can prescribe all the brands. I think that's the take home message. We can prescribe all of the brands of flea, tick, and heartworm preventative. The combination of Bravecto doesn't include a heartworm preventative, but things like NexGard, Credelio, and Simparica, you can get the with or without heartworm preventative. And that's usually the question for me with pet parents on the platform is, are we going to do, the one with or without heartworm preventative? And I don't have a strict policy where if a pet parent wants Bravecto, I'm not going to say, no, you have to get Simparica.
Mhm.
The best preventative is going to be the one that the pet actually gets either monthly or for Bravecto every 3 months. So it's the one that they actually get on time is the best preventative. And we sell all of them.
Mhm. Bill, final question on this. Bill Glosser, who says, I need hard guard for 5 large dogs that don't ride in vehicles. Vets no longer make farm calls. Can you help with that? And I'm assuming the answer is
Yeah.
yes.
Yeah. Same thing. Um, there are a few of us vets out there that are still doing farm calls, but the ones that are not usually stocking dog and cat medications at the same time. So I feel you. The days of James Harriet are are gone. This is absolutely something that we can help with. We can prescribe HeartGuard or TriHeart, any of the heartworm or intestinal parasite preventative. I get you though. I used to be one of those vets driving around in my truck, so we're here for you.
For those joining us, we are Dutch. We're an online vet service available night and day. We're doing our weekly live stream with Dr. Kate. She's answering your questions. And we've been sharing customer stories. And we had a lovely chat about MJ, the cat, but then also want to talk about Chini. Um, and a recent visit that Dr. Kate had on the Dutch platform.
Yes, this is Chini, a Great Pyrenees. She's a 2-year-old Great Pyrenees. And actually, I came across this case. One of our other vets saw this pet and I came across it and I just thought it was such a good example because I also had I see this type of case all the time. But Chini's pictures, I mean, look at how cute she is. So Chini is
So
a 2-year-old Pyrenees, and she came to us because she was having UTI signs. So, um, paint this picture like the family was hanging out in the afternoon, and after dinner, they noticed that Chini was having urgency, having to pee, and peed in the house. And so they, you know, it's 7, 8 o'clock at night and their vet clinic's not open, and but they want to help Chini and they know that UTIs are painful. So the pet parents signed up for Dutch, and actually within an hour they were able to schedule an appointment with one of our doctors. And I know how rewarding it is to be able to, when you're worried about your pet, to be able to help them quickly, and to not feel like there's nothing that you can do or that you just have to wait until an appointment's available. So this was a really great story where they were able to hop on. They had a conversation with one of our doctors, and because Cheney is an otherwise healthy young dog, the risk of her having something more complicated like stones or something else going on is really low. So this veterinarian felt very comfortable saying, this looks like a regular UTI. I'm going to prescribe you something for pain and some antibiotics to start treating it right away. And the prescription was called into, actually, no, they offered to have this prescription called to a local pharmacy, but this pet parent um, asked for express shipping. They selected express shipping, and they got their antibiotic by 10 a.m. the next day through our
wow.
provider.
Wow.
So, and that's probably faster than the pharmacy would have been able to process it. So, So they were able to start Chini on an antibiotic the next morning, which is really great if if there's any women watching that have experienced what it's like to have a UTI. That feels good for the pet parent and for this dog to be able to get something for pain, and to treat the infection quickly. And so, yeah, I can read. Let me pull up Chini's note from her pet parents, but they were so grateful to be able to treat her quickly. And I think something that this highlighted for me is, UTIs for pets, they're not like, it's not life threatening, right? It's urgent and uncomfortable for the pet, but there's also this element, especially as a pet parent, like you want to be able to help your pet quickly, and if your vet's not open, right, or you have to go to an ER, maybe the ER is like hours away, the just being able to help them quickly and to know you're doing something and taking action feels really good as a pet parent, as opposed to just waiting, maybe the vet says like, oh, I can't take you till tomorrow. And that is heartbreaking. And I think that's like sometimes we forget how important it is to act quickly, not just for the pet, but also for the pet parent, so they're not stressed waiting as well.
Hmm. What would happen? I think a common question we get is, okay, let's say if this UTI didn't go away, what would you do in that situation?
So if the UTI, you mean if the UTI was untreated, or if we treated with antibiotic and the UTI and
Yeah.
the UTI didn't go away?
Yeah.
Okay, so in that scenario, there's a couple different things that would happen. We're not robots, neither are pets. So we would have a conversation with the pet parent, like on our messaging system. Pet parent would probably message a veterinarian and say, "Hey, my dog's still peeing inside the house, and I noticed a little bit of blood. This hasn't gotten better." And then your vet would probably recommend going in person to a veterinary clinic to have a urine test done, and to have maybe an x-ray done to check for stones. If it was an older dog, there are tests that we can do to look for types of tumors or less common things that show up in the bladder. Dogs can get recurring UTIs and resistant UTIs, but that's actually pretty uncommon. Um, for it to just be the wrong antibiotic or that it's a resistant antibiotic, that's what we want the answer to be a lot of the time, but that's actually not super common. So we need to do some more testing, to figure out what's going on, why they didn't respond. I've had pet parents say, "Oh gosh, like I can't get into my veterinarian for a couple of weeks." Or I just can't take off of work this week to go, in which case we would send them a urine test kit. And oftentimes, even for a dog like Chini, I'll give the pet parent an option, even though she's a young dog and this is likely an uncomplicated UTI. I'll send a urine cup, and the pet parents can test the urine, and we'll start treatment at the same time, but we'll also check the urine. So we've got that so that we can say, okay, this didn't clear up and I've got test results that show why. Maybe there's crystals in there. Maybe we need to use a crystal dissolving diet, things like that. That test we can ship to pet parents, and they can do it all at home. And then your vet, online at Dutch, can work with you on a treatment plan.
We just got another live question from Eileen K. She says, can Dutch prescribe insulin and gabapentin? I have the records.
Yes. So we can manage diabetic patients through Dutch. We can prescribe insulin, and we can walk you through, if your, let's see, is this a dog or cat? Either way, if your pet has a monitoring system called a Freestyle Libre, where we're checking, their insulin levels at home, that is a great tool that can be used through telemedicine to monitor your pet's response to insulin, and it can be used to adjust the dose. So managing diabetes through telemedicine, it's actually like a really great tool. Also because your pet's at home, and sometimes stress affects blood glucose levels. And when pets come into the clinic, they're stressed. So getting like readings in their natural habitat at home is actually really great. For newly diagnosed pets, though, if we're thinking, oh, maybe your pet has diabetes and they haven't been tested or haven't had labs, definitely the preference is for them to go for that initial diagnosis in person. And once that diagnosis has been made, and insulin's been started, Dutch is a great way to manage diabetic patients.
So we have a lot of questions in general, actually, on chronic conditions and ongoing prescriptions. And it's great to get these questions on our live stream. If you're new, we're Dutch. We're a 24/7 online platform. You can talk to a real veterinarian night and day. And the next question is from Kimberly Wilson. She says, can Dutch provide pain management for a senior dog with arthritis, such as carprofen or gabapentin?
Yes, 100%. We can prescribe pain management for senior dogs. There's so much that we can do for senior dogs through virtual care, through a platform like Dutch. And the pain management, carprofen or Rimadyl or Carprovet, has lots of different names, and gabapentin. Those pain medications are just one part of senior care management. But actually, getting on a video call with a vet and kind of talking through things in your home, like steps, or stairs, or what your floors look like slippery floors. Those things, like your vet can help you make your home like a perfect place for your senior pet, because a lot of the time senior pets are struggling. They're struggling with pain, but also things in their environment can be adjusted to make getting around a lot easier. I'm a huge fan of putting yoga mats or rugs down anywhere where you have tile. It's like such a fashion statement or just interior design statement, but can be really helpful. And most dogs have their routine. Senior dogs like have a path that they take. They go to the food and water bowl, they go to the couch, and they go outside. And we can help them with those areas, making it so that there's no stairs and that they have nice traction, and it's easy to access the things that they need. And then we can also talk about diet and weight and building muscle and reducing fat, which is a huge important part of any dog with arthritis. We can talk about supplements. I don't think of supplements as like the plan for arthritis, but they can be a part of it. So yeah.
We're getting lots of live questions.
Great. I love live questions.
Yeah. The next one, can Dutch prescribe asthma medication if my cat was already diagnosed?
Yes, definitely. So for cats, asthma is actually very common or not uncommon in cats. Um, and so, yeah, most of the time, what we'll do for pets is they'll start on an oral steroid, and then we'll transition them to an inhaler. Cats can get inhalers just like people. Or a lot of the time when I first tell pet parents that, they're like, what? It sounds so funny. But you can get a cat pretty used to an inhaler, going slowly, and getting them comfortable with it. And yes, our vets are comfortable prescribing the steroid inhalers, as well as like a rescue inhaler that helps relieve in those kind of emergency situations. We can prescribe both of those. And sometimes when cats that have had asthma have like a flare up, especially like in the summertime, we will say, okay, I know you've been working with your inhaler. I want you to go back to like 1 week of oral to kind of reduce the inflammation. And then we're going to transition back to the inhaler again. And we can do all of that through Dutch, through virtual care. And that's actually like a great tool. Cats are great for telemedicine. So if you've got a question for a cat, and I think cats would say the same thing, I joke that this like those signs that Chick-fil-A has that say eat more chicken. I think if cats instead of cows were up there, they'd be writing like use more telemedicine because anytime they can just stay at home and not have to go to the vet, like you've got a happier cat.
Yep. Okay, another question from Arelis20. Can Dutch do blood work?
Maybe one day, but
Not
no,
yet.
not yet, not right now. Yes, not right now. What we can do is if you have lab work that you've gotten from another vet, our vets can analyze that and make a treatment plan with you. But not yet. It's a good question
Actually,
though.
on that note, someone said, Colleen Thorne, she says, my almost 12-year-old cat needs Serenia and prednisone so she doesn't vomit. Blood work keeps coming back normal. Can you prescribe those or something similar to Serenia that's chewable?
Yes, we can prescribe Serenia and prednisone for your cat for sure. Serenia is an anti-nausea medication, and yes, we can prescribe those. And then your vet would also talk to you about, you know, like what are other things, and maybe you talk to the vet in person about this. If the blood work's coming back as normal, what could be another underlying cause of the vomiting, and are there things that you could do at home from that? So yeah.
For those joining us, we are Dutch. We're an online vet platform available 24/7, night and day. We love hearing your questions. If you are listening now, send us the dog or cat, age, breed, give us more info, and we'll do our best with Dr. Kate here answering your questions. In the meantime, we have a ton of questions around allergies, just to switch it up. We have a question from Spudsy's Mutt. How to help a pitty with allergies and constant itching?
Yes, and Joe, we should mention that you can get up to 5 pets on your membership. One
Yes.
membership up to 5 pets.
Yes. For less than
Yes,
$100.
yes. Okay, Fuzzy Mutt. How to help a pitty with allergies and constant itching. I saw 2 pitties yesterday that had allergies and itching, and this is really common right now, and there's a couple things that could be contributing to it. Um, First thing I would think about is you want to make sure that your pitty is on a prescription year-round flea preventative. That's so important. Dogs get allergic to flea saliva. So even if you're not seeing fleas, even if you live in a really urban area, that's the rule out number one. One flea bite can set them off to be extremely itchy, and the most common places to see flea allergy dermatitis, that's what we call it when they're having an allergic reaction to flea saliva. The most common areas for that are around the tail base, around the rump, and the groin area. That's where fleas like to hang out and really irritate dogs. So along the top of their body towards the tail base. Okay. If this is allergies to things in the environment, we see a couple seasonalities of that. Definitely spring, summer, and then again, like another hump in the fall, where, some pets, you will only see them have these like itchy outbreaks during that time. Some pets have like a baseline itchiness, and then it gets worse during those times. So, what can you do to help? Well, removing the allergens from their body is step number one. Things that you can do at home: bathing, wiping their paws when they come in from walks, using like a good shampoo that's not going to dry out their skin. During the flare up times, you could bathe them a couple times a week. Um, and that can be really important as something that you do at home. Then if they've got an underlying skin infection, you'd want to talk to a veterinarian like a vet at Dutch. Sometimes these dogs are so itchy that they're scratching at themselves and they cause a skin infection that needs treatment. And then we would also want to stop the itch with something called Apoquel or Zenrelia or Numelvi. We have these new drugs available to us and available to all of our Dutch members, where they target the itch very specifically, unlike Benadryl. Actually, one of the pets I saw yesterday was on Benadryl. I could see it was like very drowsy, kind of out of it. Benadryl is more of a general medication. Usually, we think that Benadryl relieves the itch just because the dogs are sleepy and less reactive to it. more than anything else, it doesn't dampen that like sensation, like them feeling itchy. That's what Apoquel and Zenrelia and Numelvi target. We could prescribe all of those. And then when they're feeling less itchy, then they're not scratching themselves as much and they're not as likely to cause those skin infections. So those are environmental allergies. Now there's oftentimes this one, I don't want to complicate this too much and overload people, but there's oftentimes overlap between environmental allergies and food allergies or dietary sensitivities. Um, they're not mutually exclusive. Oftentimes, a pet with one is going to have some of the other as well. And to know for sure if your pet has a true food allergy, the way that you would know that is by doing a diagnostic trial with a specific type of food, hydrolyzed protein food, or if they've if they have like what they've eaten their whole life and you can find a protein that they've never been exposed to before, like kangaroo. You could try feeding a new protein diet like that. And only that, this is the hardest test of all because it requires a lot of work from pet parents at home. If somebody were to tell me I had to do this for my dog, I'd be like a little overwhelmed. Um, but it is an important part of figuring out what your pet is allergic to in their diet. So feed that food and only that food for a couple of months, and see if their skin gets better. Okay, that was a long-winded answer, but that's true. That's that's
Yeah.
what we would
Well,
do.
I think what's awesome about it is we live in a world of AI and Dr. Google, and so much of what you said. The point is, every pet, every situation is so individual, and you get to talk to a live human licensed veterinarian who likely has years and if not decades of experience. And what you just said is highlighting how talking to a vet, having a real conversation that you can afford, can really unlock how to take care of that specific situation. And also, then the other thing you said earlier is, we're not robots. And so it takes a lot of back and forth for some of these, for things like allergies, that if you have to keep coming back into an office, you might not really follow up on that strategy. Whereas here, it's a lot easier to have a check-in, to reconnect with a veterinarian to see what's going on.
Totally. And the back and forth conversations are really important. Like one of the conversations I had with a pet parent is I outlined, okay, like what are our goals today? And they're like, I just want them to not be itchy. I'm like, great. We're going to prescribe this anti-itch medication. You're going to start wiping paws and bathing, and then we're going to check in. But if the goal is to really like do all of the things and to figure out what's going on underlying, through Dutch, like we can walk a pet parent through that and have these check-ins like, okay, now how's it going? Now we're going to try adding in the diet and make a specific recommendation for that. So anywhere on the spectrum, we can help pet parents. Sometimes it's just, let's do some Apoquel. And sometimes it's like, let's come up with this whole comprehensive plan and we're going to have regular check-ins because it doesn't cost pet parents anything when they want to message their vet or when they want to ask a question or if they want to have another call. We can do that through the platform.
On allergies, Stephanie Thomas asks, my dog gets seasonal allergies and gets an injection, but it's so expensive. Is there something cheaper?
Yeah, this is probably Cytopoint. They're probably getting Cytopoint injections, which is a great tool. Cytopoint actually specifically targets itch related to environmental allergies. Um, and so we do have an oral pill. What I was just talking about was Apoquel, and then also some others in that same category are Zenrelia and the newer one, Numelvi. All of those oral medications, they target itch specifically, and they'll help with itch related to environmental allergies, just like the injection. And they'll also help with itch related to food allergies or skin infections. So a little bit more coverage. with that oral medication, and it's an alternative to the injection. Um, I mean, I would say anytime a pet is on an injectable for itch, like Cytopoint, anytime they're on Cytopoint, you can switch to Apoquel to the oral. The only time I would say keep on the injectable is if you cannot give your pet an oral medication. Like if that, if they won't take an oral medication and an injection is the only thing you can do, that's when I would say stay on that. Otherwise, the oral pill can be given. It can be given as needed also. That's the other thing I think that people forget with Apoquel and Zenrelia if your pet has this kind of seasonality to their itch, you can be giving Apoquel, and then as you see it starting to get cold and there's less pollen and things that are causing the allergies, you can stop the Apoquel and then start giving it again. And I recommend giving it like a couple weeks before you started noticing signs the previous year. Just mark it on your calendar. If a pet's on one of these medications year round, then I say, okay, you should get some lab work and just make sure any medication is metabolized in the liver and processed in the kidneys. So that kind of blood work can be helpful. But yes, I like dogs with allergies to have like their own kind of stash of Apoquel at home because it's easier to start giving Apoquel before a flare, before a hot spot, before they're chewing on their paws so much that they're raw. We want you to be empowered to give that, your pet's best, and that way they don't have this hot spot develop in the first place.
This question is a double whammy. It's from Christopher Sambrooks. He says, I have 5 dogs, 3 with allergies and skin conditions. Can you help with allergy meds and flea treatments?
Yes, and you have the perfect number of pets to be a Dutch member. Yes, and 3 of them with skin conditions and allergies. Man, I know what you're going through. So yeah, we can get all 5 of your pets on a prescription flea prevention. And that's a good call out and I had this yesterday as well. If you've got one pet that is having some flea issues, that means all the pets in the house are exposed and you want all of your pets to be on a prescription preventative. Because if you just put the one that's showing issues on a flea preventative, the others are going to be reservoirs for fleas and you're never going to get to the bottom of it. And so I'd say get all 5 of them on their flea medication. Make sure you're vacuuming and vacuuming the house as much as you can. And fleas like to hang out like in between couch cushions and like in the back of closets where there's carpeting. So vacuuming actually stimulates the flea life cycle to go through its life cycle of eggs and larvae faster. So you'll clear an infestation faster that way, and then wash bedding in hot water. And then, yeah, we can get you some Apoquel or whatever anti-itch medication you need. And then another thing that gets lost in these kind of chronic allergy pets is you can have a maintenance shampoo that's a hydrating shampoo that has components that will help the skin barrier. And you can do those kinds of maintenance baths in between them having flare ups, and that's going to help protect their skin um, and reduce the risk of having a flare up. And actually, omega-3 fatty acids are one of the supplements that have been studied and that show they actually help the skin barrier as well.
We have time for one last question from Michael Dean DeBolt. He says, can you diagnose a yeast infection in dogs and prescribe the proper medication for it?
Yeah, we can prescribe antifungals as well. We can diagnose the yeast infection through a couple of different formats. So we can send a swab for you to actually get a sample at home, and I can talk pet parents through. Sometimes, depending on where the infection is, like if it's on the paws, I'd actually have a pet parent kind of roll back the skin that overlays the toe and that overlays the nail. And you can, with a Q-tip or with a toothpick, collect some of the gunk that hangs out in there and send it off to the lab. I hope I didn't just gross everybody out. I do this stuff every day, so I'm like, I forget that it's gross. But so we can collect samples like that and have our lab analyze, because sometimes it's just yeast, but sometimes there's yeast and bacteria, in which case we'd want to treat both. And then I am working with our lab to develop like a skin tape test so that you can at home be the scientist if you want to, and get a sample by using just some tape that we would put on a slide and look at it under the microscope so that we can really do those diagnostics to know what we're working with, and then absolutely prescribe an antifungal. When it comes to antifungals, it's important to make sure that the liver is functioning well and that the kidneys are functioning well, because they process those and they can be a burden on the liver to process those. So if your pet has any history of those issues, I would think about that ahead of time. But yeah, you don't want to let a yeast infection go untreated. Those can be one of the most itchy types of infections for pets. And so I oftentimes will prescribe Apoquel on top of that. And for any skin infection, treating the infection at the source with a topical and bathing and topical mousses, you actually get the highest concentration when you're treating them topically. So we can prescribe the right products and a regimen and reduce the itch that way, and then follow up with you. And we can also check afterwards to make sure with another test that we've cleared it up, if you want to be really thorough, and make sure that we've like totally knocked out the infection. So yeah, yes, we can absolutely diagnose and treat that. I probably gave you more information than you bargained for just now.
Well, it's such a treat to hear examples, and again to see how nuanced each situation can be. We're wrapping it up. Thank you all for joining. We are gonna move from weekly to every other week. So join this channel. You get to hear Dr. Kate answer questions from the Dutch live stream. And then we have our promo code from this week's episode, No Trip 50. You get $50 off. And we hope you try us out on Dutch.com. See you in 2 weeks.
See you in 2 weeks. Thanks for all the live questions today.
Bye.
Bye.